Dear members of the Council of the IPA, dear colleagues within psychoanalysis, dear all. As director of the Sigmund-Freud-Institut in Frankfurt, and as the head of the team at the Sigmund-Freud-Institut that is being honored with the IPA in the Community and the World Section Violence Award, my award-winning colleagues and I, as well as our entire institute, we are of course very proud for this appreciation and recognition from the IPA. We are also very delighted to be able to join you all online in Cartagena, Colombia, for this beautiful moment of honoring our psychoanalytically oriented work with refugees in Germany. The Psychosocial Center in the Frankfurt area, to which the SFE, the Sigmund-Freud-Institut, contributes with its psychoanalytically oriented preventive and pre-therapeutic work during the first phase of arrival of refugees in Germany, is an ongoing psychosocial project since 2015, since the so-called refugee crisis in Europe. The psychoanalytical orientation of our interventions for refugees in Hesse, Germany, has been set up originally within the step-by-step project of Sabine Andresen from the Goethe University, Frankfurt, together with the former director of the SFE, Professor Marianne Leutzinger-Bohrleber. Since 2017, this pilot project, with the aim of preparing further steps of integration in Germany by offering within the first months of arrival of refugees a holding and containing therapeutic intervention, has been further developed by our SFE team together with our colleagues from 4 other organizations, among which the Frankfurt Psychoanalytical Institute and the Anna Freud Institute. The project is financed by the Hesse Ministry of Social Affairs. At the Sigmund-Freud-Institut, we not only worked out the intervention program for refugees in the arrival camps, but also a research project in which we have been able to prove that integration processes of children and adults can be improved significantly by early interventions in which holding, containment, self and affect regulation, as well as early mentalization about cumulative losses and trauma are central components. Our colleagues from the team, Raem, Abd-Al-Majeed, Sima, Saligheh, Stier, and Corinna Poholski, offer several kinds of weekly interventions, both individually and group-oriented, for men, for women, for mothers and infants, as well as meeting and drawing groups for latency children, and meeting and activity groups for adolescents. Our psychoanalytically oriented team is also involved in outreachment in several ways. Firstly, within the arrival camp, for example, by actively going in search for the most vulnerable and isolated refugees, and by being present on the terrain amidst the target group in order to lower the hurdles for asking help. Secondly, by actively contributing in referrals for further treatment once refugees have left the first arrival camp. And thirdly, by giving a voice to this kind of engaged psychoanalysis within society. This part of our work also involves intervision with other care workers, as well as the organization of workshops and congresses and dialogues with policymakers. On behalf of my colleagues, directors at the Sigmund-Freud-Institut, Professor Vera King and Professor Heinz Weiss, and in the name of the Sigmund-Freud-Institut as a research institute, I want to express once more our gratefulness for being awarded by the IPA for the psychoanalytical work that is done at the service of a very vulnerable group within our society. The IPA award will be accepted by Dr. Heinz Weiss, who represents the Sigmund Freud Institute at the Cartagena Congress. Thank you very much once more.